In a shocking turn of events, a doctor found himself facing a board of medical examiners, accused of crimes he did not commit. This wasn't just any doctor. He had treated some of the most infamous figures of the 1970s, including Elvis Presley. The scene was set in a stark, unforgiving room where the air was thick with tension. Here, a doctor's life and career hung in the balance, all because of a series of prescriptions that had been twisted and misinterpreted. It started with a routine hearing that quickly spiraled into a public spectacle. The prosecution called witnesses, each with a story that painted a grim picture of prescription abuse and neglect. But at the center of it all was the doctor struggling to explain his actions, to prove his intentions were pure. His patients, once confidential, were now on trial, their secrets laid bare for all to see. The doctor, let's call him Nick, had always believed he was doing the right thing. He treated Elvis Presley, a legendary figure whose very name conjures images of glamour and excess. Elvis was not just a patient, he was a friend, a man who had been through hell and back. Nick had seen the darker side of fame, the loneliness and the pain. Elvis had come to him in his vulnerable moments, seeking relief from the constant pressure and the demons that haunted him. Nick's relationship with Elvis began when the rock star was filming movies and touring relentlessly. As Elvis's personal physician in Memphis, Nick became his primary care provider, but it wasn't easy. Elvis struggled with sleep, plagued by nightmares and anxiety. He had chronic pain from arthritis that crept into his back and neck. The pressures of touring took a heavy toll, accelerating his drug use, especially when he was on the road. The prosecution's case hinged on a series of prescriptions. They claimed these were evidence of addiction and abuse, but Nick knew better. He explained to the board how he prescribed medications not just for Elvis, but for his entire entourage. The prescriptions were for 100 people who traveled with Elvis, not just for Elvis himself. His father, who paid the bills, would only fund the prescriptions if Elvis's name was on them. It was a practical solution to a complex problem. Nick recounted how he had to hospitalize Elvis after a near-fatal illness in 1973. Elvis had been given drugs during a controversial treatment in Los Angeles, and the aftermath was dire. Nick had to call in drug abuse specialists to detox Elvis, a task made harder by the fact that Elvis had been given unknown substances. Elvis's health remained fragile, marked by frequent illnesses until his death. When the prosecution pressed him about Elvis's addiction, Nick clarified, "I thought he was addicted when I first started treating him in 1973, but I never thought he was an addict. He had a history of psychological dependence on sleep medications. He had sleep disturbances, serious nightmares, and anxiety." Nick used placebos extensively, but Elvis's pain from arthritis could not be ignored. There were days when Elvis took no medication at all for pain or insomnia, especially when he was at rest. The trial took an unexpected turn when the prosecution called Nick to the stand. The very idea seemed absurd, testifying against himself, but the rules of the hearing allowed it. Nick's attorneys fought hard, arguing that such a move was illegal. After a tense debate, the decision was made to let Nick testify, but only after a delay that would prolong the ordeal. On the day of his testimony, Nick stood before the board, his heart pounding. He spoke honestly, detailing his relationship with Elvis and the challenges of treating a high-profile patient with complex needs. He explained the misunderstanding about the prescriptions, how they were often for the entire crew, not just Elvis. He spoke of the equipment he carried, the medicines for allergies and emergencies, and the reasons behind the multiple prescriptions. As Nick spoke, it became clear that the prosecution had misinterpreted his actions. They saw greed and negligence, but Nick saw care and concern. He had always acted with the best interests of his patients at heart, even if those patients were part of the glittering, often ruthless world of show business. The trial was far from over, but Nick knew he had to keep fighting. His reputation, his career, and his integrity were on the line. In a world that often judged based on appearances and rumors, Nick had to prove that his intentions were pure, that he had walked a fine line between helping his patients and navigating the complexities of fame. During the hearing, the doctor shared his experience treating Elvis Presley, trying to paint a picture that went beyond the mere numbers of prescriptions. He explained that Elvis's situation was unique. Elvis could earn a staggering amount of money for just 2 shows, but he couldn't afford to have his key musicians fall ill. Since many of Elvis's songs relied on visual cues, his regular band members were crucial to his performances. This reliance meant that any illness among them could derail a show. The doctor then tried to clarify a vital point about Elvis's medication. He stressed that Elvis didn't have direct access to his prescriptions. Instead, the doctor kept them and handed out doses as needed. This method was necessary because Elvis's schedule was unpredictable and his health needs varied. The doctor admitted that this approach led to a major oversight: poor record keeping. He explained that confidentiality was a concern, both in the hospital and when other healthcare providers accessed Elvis's records without authorization. The doctor expressed deep regret over his own shortcomings, particularly his sloppy record keeping. He believed that if Elvis had lived, his health would have shown improvement over the last couple of years, despite his substance use. The doctor acknowledged making strides in helping Elvis but lamented the constant refusal of Elvis to seek proper psychiatric help or attend sleep clinics. The defense team quickly moved to another part of the story, calling 2 women who had been close to Elvis, Sheila Ryan and Shirley Dia. Sheila spoke about Elvis's sleep issues and confirmed that the doctor administered his medication, usually at night. She noted that Elvis didn't always have a personal supply of drugs, and there were times when he couldn't get what he wanted from the doctor. She mentioned arguments over medications, showing that control over Elvis's drugs wasn't always straightforward. Sheila added that she had seen the doctor replace a pill with a placebo, something the doctor confirmed without denying it outright. This admission highlighted the complexities of managing Elvis's medication. Shirley Dia provided a different perspective, focusing on Elvis's tour. She confirmed that Elvis did not use alcohol or marijuana, and he strictly forbade it among his team, fearing the consequences. Shirley noted that while Elvis took medication, it was always for health reasons, not recreation. She described how Dr. Nichopoulos would sometimes replace medications with sugar pills, a practice that Shirley witnessed firsthand. Both women spoke highly of Elvis's kindness and generosity, emphasizing that he made everyone feel special. Shirley added that she had no reason to believe the doctor harmed Elvis, which seemed to satisfy the board, who appeared more interested in her testimony as a distraction. The next day, the medical group's coordinator testified, providing a broader context. With over 15,000 patients, the doctor's practice saw only a tiny fraction of them receive prescriptions for controlled substances. Out of his total patients, only about 1 in 20 received such prescriptions. This statistic aimed to show that Elvis's situation was not typical or widespread within the practice. Tish Henley, Elvis's private nurse, took the stand next. She lived in a trailer behind Elvis's house and was responsible for managing his medications since 1975. Tish kept Elvis's drugs in a locked bag in her trailer, ensuring they were secure. She also accompanied the doctor on tour, taking care of medical needs for the entire team. Tish's role and her close proximity to Elvis lent credibility to her account of the doctor's practices. Through these testimonies, the defense aimed to humanize Elvis's situation, showing that managing his health was complex and fraught with challenges. They hoped to shift the focus from mere numbers of prescriptions to the real-life struggles of treating a high-profile patient with unique needs. In a significant hearing, Dr. Nichopoulos faced intense scrutiny over his medical care for Elvis Presley. The hearing aimed to determine if Dr. Nichopoulos had acted unprofessionally, particularly concerning Elvis's death. The core of the issue revolved around whether Dr. Nichopoulos had prescribed medications without proper justification, especially during Elvis's tour. Initially, Tish, a close associate, testified confidently about Dr. Nichopoulos's reliability. She said she never questioned his decisions because she knew he always did what was right. However, this testimony was later challenged when evidence surfaced showing a direct link between Elvis's tour and the increase in medications prescribed in his name. A chart was presented, overlaying the tour Elvis went on with the rise in drug prescriptions. Despite this visual evidence, the media did not report on it, making it seem as if the testimony was never given. Felton Jarvis, Elvis's friend and manager, added to the narrative. He explained his role in taking care of Elvis's band and how Elvis used his influence to help Jarvis, who was battling kidney failure. Jarvis spoke about the countless shows Elvis performed despite his health issues, which included diabetes and kidney transplant. This testimony highlighted Elvis's dedication despite his struggles, contrasting with claims that he was too fatigued to perform. The hearing took an unexpected turn when Joseph Dugman, an investigator, admitted that his team had met with ABC News before filing charges against Dr. Nichopoulos. This admission revealed a possible bias and collusion, suggesting that the investigation was not entirely objective. Dugman had denied prior contact with ABC, but this claim was contradicted by another investigator who admitted to sharing information with the 2020 team. Furthermore, a freelance researcher had given crucial information to the investigators, hinting that the charges were pre-planned. Dr. Walter Rothman, a respected medical professional who had known Dr. Nichopoulos since his academic days, testified about Elvis's empathy and the challenges in managing his medical records. He admitted to not always keeping detailed records, a common practice, but acknowledged there was no legal requirement to do so beyond keeping notes. Dr. Lawrence Rubble, a specialist consulted for Elvis's gastrointestinal issues, testified that Elvis was over-medicated, particularly with cortisone. When confronted about Elvis's excessive drug use, Dr. Rubble admitted concern, but also revealed that Elvis insisted on taking drugs to sleep after performing, citing the exhausting schedule. After discussions, Elvis agreed to reduce his shows, which improved his condition. This testimony humanized Elvis, showing he was actively involved in managing his health. Other doctors who had treated Elvis through Dr. Nichopoulos's referrals testified that Elvis showed no signs of drug abuse during their examinations. They praised Dr. Nichopoulos for his genuine interest in his patients' well-being. The hearing reached a critical point when the state prosecutors suggested that Elvis's death should be considered part of the case against Dr. Nichopoulos. This move was met with strong opposition from Dr. Nichopoulos's attorney, who argued that while Dr. Nichopoulos was charged with unprofessional conduct, he was not accused of murdering Elvis. The prosecutors wanted to bring in the autopsy report, but the doctor performing the autopsy was under a legal obligation to keep its contents private until a lawsuit was resolved. This legal barrier prevented the autopsy details from being part of the hearing, frustrating some, including reporters who had pushed for transparency. Throughout the hearing, emotions ran high, especially when the prosecutors pushed for accountability for Elvis's death. However, the defense successfully highlighted the complexity of Elvis's medical situation and the challenges faced by Dr. Nichopoulos. The testimony showed that while there were issues in record-keeping and perhaps overprescription, Dr. Nichopoulos acted with what he believed was in Elvis's best interest. In the end, the hearing underscored the human element behind the medical decisions made for a legendary figure. It showed that even well-intentioned professionals can face scrutiny and that the truth behind medical practices can be complicated. The case of Dr. Nichopoulos and Elvis Presley remains a poignant reminder of the intersection between medicine, fame, and accountability.